Well, health leaders are concerned about an alarming trend for Hoosier children. The Indiana State Department of Health is reporting a drastic drop in the number of kids getting routine immunizations during the pandemic. A nonprofit in Fort Wayne is helping lead the charge to get kids caught up. And Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. SuperShot in Allen County is the second largest provider of vaccinations in the state. So it's among clinics reporting a major drop in the number of vaccinations during the pandemic. The Indiana State Department of Health says compared to May of last year, 137,000 fewer vaccines were given this May. That's a 47% decrease. The CDC says getting kids caught up is critical to protect communities from vaccine-preventable disease outbreaks, and SuperShot is leading that effort in Northeast Indiana. Joining me now to tell us more is Connie Heflin, Executive Director of SuperShot. Connie, thanks for being on the show today.
Thank you so much for having me. I appreciate it.
Absolutely. We'll dive into those alarming numbers in just a couple minutes. But first, I want to talk about how SuperShot came to be, because it really is a unique story. It's backed by a lot of support now from local healthcare. But tell us how it got its start during the measles outbreak in the early 90s.
Yeah, you're right. SuperShot is unique to Allen County. We were founded by two very strong women in the early 90s as a response to the measles outbreak. Back in the 1990, just in that year alone, there were 27,000 cases of measles in the United States. And Dr. Jane Ermshire, the local health commissioner at the time, and Sister Mary Conrad, a poor handmaid, said, Allen County, we really need to do something about our low immunization rates and protect kids specifically against measles. So at that point, those two women brought community leaders together and created what was called a SuperShot Saturday, and any child could come and get their immunizations at no charge, and they would line up for blocks down the street. And from there, that initiative, SuperShot, as a nonprofit, evolved, and we're here over 27 years later.
Such a strong presence there in Northeast Indiana. Let's talk about these recent vaccination numbers as a result of COVID, especially looking at May. The State Department of Health says nearly half of all Hoosier children did not get their required vaccinations during that month. So give us a look inside why that drop happened, is happening, and also your message right now as SuperShot tries to build those numbers back up.
Right, exactly. Those numbers are alarming, and it puts our children at risk for vaccine-preventable diseases. And as a community, we need to come together and really create that awareness. But the reason it happened, it boils down to access and fear. During the stay-at-home orders during March, April, parents didn't have a place to take their kids. A lot of doctors moved to telehealth, departments of health moved to focus on COVID, and there wasn't a lot of access points. SuperShot, we did remain open. We temporarily took over the immunization services of the Allen County Department of Health, but then it came to fear. Parents were very frightened to bring their children out during those stay-at-home orders. So now, it's not behind us, but we really have to encourage parents that procedures are in place where we can provide immunizations safely. We've got social distancing, checking temperature screening, and now we need to get children back on track so they're not at risk for a vaccine-preventable disease.
And I definitely want to talk about the flu vaccine. The CDC is saying that's critically important this season so you don't have the extra burden of the flu on top of already another respiratory issue with COVID. So explain sort of your message surrounding the flu vaccine this fall.
Correct. You nailed it there. We really need families to start thinking ahead that they're going to plan to get their flu shot this year. It's so important this year so we don't stress our health systems with both COVID and flu cases. And so SuperShot here locally in Allen County, we're really working and partnering with the local schools to do in-school flu immunization clinics to further break down those barriers, take the flu shot to the schools, make it convenient for families, but really trying to encourage families, all members of our community. If you don't get your flu shot, typically, this is the year to get your flu shot.
And back to the routine vaccinations, you pointed out that Indiana schools will not be easing their vaccination requirements at all this school year. And also the Indiana High School Athletic Association is not requiring student athletes to get new physicals this year. Explain how that could be an issue too.
Yeah, that is an issue because that sports physical visit really drives a lot of immunizations for adolescents. That's when their doctor catches them and gets them up, keeps them up to date. And now that those sports physicals aren't being required, we're really concerned about adolescents falling behind on their immunizations. We've seen that trend already, and we really need parents to make an effort, get into their doctor. If you're in Allen County or surroundings area, come to Super Shot. You know, people can come and get those immunizations. So don't just forego the adolescent immunizations because you're not getting your sports physical.
All right. Well, I know you're working hard up there in Northeast Indiana, but really good information for the entire state. Connie, thanks for being on the show today.
Thank you again for having us. I appreciate it.
Absolutely. Gary, back to you.
All right, Kylie, thank you.